Bismillahirrahmanirrahim. Today I'm going to deliver you a lecture on a topic of pathology, that is the disorders of white cells. Disorders of white cells. डिसऑर्डर्स ऑफ वाइट सेल्स दो किस्म के हो सकते हैं, या तो ये जो वाइट सेल्स हैं इनका नंबर ज़्यादा हो गया, या ये है कि इनका नंबर कम हो गया. सो वी कैन मेनली से दैट वाइट सेल्स दे आर disorders of white cells, they are of two types. They could be a proliferative one. Proliferative means that there is increase in the number of leukocytes, and second is the leukopenia, when there is a decrease in the number of leukocytes. Increase WBCs and decrease WBCs. अब जो प्रोलिफरेटिव होते हैं वो आगे से फर्दर दो टाइप्स के हो सकते हैं कि कोई ऐसा स्टिमुलस है उसकी वजह से WBCs का नंबर इंक्रीज़ हुआ है, या कोई ऐसा ट्यूमर था. तो हम कह सकते हैं कि प्रोलिफरेटिव डिसऑर्डर्स दे आर फर्दर क्लासिफाइड इनटू टू टाइप्स. इट कुड बी अ रिएक्टिव और इट कुड बी अ नियोप्लास्टिक. इन रिएक्टिव मतलब कोई any infection or any inflammatory process, for example infection or inflammation, as a result there is an increase in the number of leukocytes. And neoplastic, there is an abnormal growth of the hematopoietic cells, hematopoietic stem cells, so the number of WBCs increase. Now come to the leukopenia. Leukopenia means decreased WBCs. Now why there is decreased WBCs? Further, mainly it is of two types. If mainly neutrophils and granulocytes, their number is decreased, we will call it neutropenia. And if lymphocytes are decreased, we will call it lymphopenia. Lymphopenia, we mainly discuss that what are the main causes of lymphopenia, in which we specifically find in CBC, we specifically find that there is mainly the decrease in the number of lymphocytes. It could be various causes. The main causes are advanced HIV infection. Advanced HIV infection, you will mainly find that there is decrease in the number of lymphocytes. Advanced HIV infection. Or there could be an autoimmune process, due to which there is decrease a number of lymphocytes. Or there are certain drugs which mainly causes the decrease in the number of lymphocytes. And the fourth cause could be the malnutrition, which result in the decrease in the number of lymphocytes. And fifth cause could be acute viral infection. Acute viral infection, as a result there is decrease in the number. So there are five main causes of the lymphopenia. What are those five main causes? Advanced HIV infection, autoimmune disorder, malnutrition, acute viral infection, and certain drugs. Certain drugs like cytotoxic drugs which are used in cancer therapy, glucocorticoids, because they are anti-inflammatory drugs, so they decrease the number of white blood cells. Glucocorticoids. Acute viral infection, there is a slight further detail on why there is a decrease in the number of lymphocytes in acute viral infection. In a body, the overall count of lymphocytes is not decreased, it is actually the redistribution of lymphocytes. Viruses produce the interferon type 1. They mainly produce interferon type 1. And this interferon type 1, it causes the mutation in the surface proteins of the T lymphocytes. As a result, these lymphocytes have now capability of more stickiness. They stick to the endothelial cells of the blood vessels. So in the blood, mainly they are decreased. They are attached to the endothelial cells, or they are sequestered in various tissues. And this was all about the lymphopenia. Now next is neutropenia. Neutropenia, there are two main causes of the neutropenia, that why there is the number of neutrophils is decreased. The first one is ineffective granulopoiesis. Mainly the neutrophils are actually synthesizing in a less amount, or overall not synthesizing. And second is there is that the synthesis of neutrophils is normal, but in periphery there is increased destruction, increased peripheral destruction, or increased peripheral utilization, you can say. Increased peripheral destruction or utilization. Now we focus on why there is ineffective granulopoiesis. What are the causes? There could be any tumor. In case of tumors, what occur that these malignant cells, they replace the normal healthy hematopoietic tissue, hematopoietic cells, so granulopoiesis cannot occur. There could be an aplastic anemia. In this disease, there's also the bone marrow is not healthy or not functioning properly, so there's a decrease in the number of granulocytes. Then there could be a megaloblastic anemia. In megaloblastic anemia, there's a deficiency of vitamin B12. So due to deficiency, like other cells like erythrocytes, and they cannot if synthesize properly. In the same way, these granulocytes can also synthesize. And there could be certain drugs which destroy the precursors of the granulocytes. Now next come to the increased peripheral utilization or destruction. Increased peripheral destruction occur mainly in immunologically mediated diseases, like certain antibodies are formed which destroy those neutrophils. For example, SLE, or there could be no known cause that why antibodies are formed, or main like a systemic autoimmune disorder, SLE. Second is the splenomegaly. In splenomegaly, the size of the spleen is increased overall, so there is more sequestration of neutrophils and other cells as well, and so there is increased destruction.